Good afternoon, and thank you for joining us for Wednesday's virtual media briefing on COVID-19 in London and Middlesex County with London Mayor Ed Holder and the Medical Officer of Health and CEO of the Middlesex-London Health Unit, Dr. Chris Mackie. Welcome to the media who are joining us this afternoon, and of course, we welcome your questions. We invite them, in fact. You can submit them in the question forum here on Microsoft Teams. Please do indicate your name and your media outlet when you do so. We also like to welcome viewers who are tuning in on Rogers Television, the Rogers YouTube channel, and the Rogers Facebook page, as well as listeners to Global News Radio, AM 980 CFPL, and those joining us on the CTV London website. Let's get to the opening statements, and we'll start with Mayor Holder.
Thank you very much, Dan, and good afternoon, everyone. First comment I'd like to make is something I referenced earlier this week with respect to the Prime Minister's comments regarding the gas tax. And to me, the key piece there was that the Prime Minister acknowledged that municipalities across this country have a challenge, and it's a major challenge. I'm frustrated, though. I'm frustrated that the federal and provincial government have not found the wherewithal to advise municipalities where they are in the process of that meeting. Too often with the ministers and with the local members with whom I have spoken, they've all come back and said, well, the other level of government has to be willing to play. And I'm here to say they are both willing to play. And I'm going to say it clearly. These two levels of government individually have said to me they are willing to participate. And it's not good enough anymore to say that we need to hear from the other ones. I'm saying to levels of government, provincial and federal, they're willing to do their part. They need to come together. If they're meeting, let us know that they are. Let us know that these conversations are taking place. Give us some sense of timing. Because as London, Ontario goes, so goes the country. And we are in desperate position. I've said it time and again through this press conference over the months. We are not in a good place. And I am imploring, urging, demanding that the provincial federal government talk to each other, clear specific terms, and advise municipalities of their status. So look, on a brighter note, there is some really good news coming from our library system, and that they've confirmed resumption dates for returns and pickup services. And within a week, June 8th, actually, pickup service is going to be allowed at a number of branches: Peacock, Byron, East London, Jalna, Masonville branches. And a week after that, Bostwick, Crouch, Landon, Pond Mills, and Stony Creek. And after that, a week later, tentatively, there will be pickup from the Central Library, and Cherry Hill and Sherwood will begin offering pickup once malls will reopen. But there are some that aren't available as yet: Carson, Lambeth, and Glanworth, and that's due to distancing limitations. So we want to share that with you. For more information, you can go to londonpubliclibrary.ca. Finally, not related to COVID, but it's important for me to say, if you haven't heard already, I want to encourage everyone to listen to the very moving comments made by my colleague, Councillor Mosley, at the beginning of last night's meeting of council. You can find them on any of the mainstream media websites in London. He spoke honestly, passionately, and openly about anti-Black racism in London and the need to challenge and change that environment. Personally speaking, I've heard too many times over the last few days, well, look, it's not as bad in London, or that isn't a problem in London. Well, let me be clear. Yes, it is a problem. And the question of whether it's worse or better is frankly irrelevant. What matters is that anti-Black racism exists, and that all of us, at the very least, must acknowledge that. We must also listen to and amplify voices of those who are directly impacted and work with them to eradicate anti-Black racism in all of its forms. All of us, all Londoners, all Middlesex County citizens, all who can hear this message have a role to play, myself included. And a big part of that role is to listen. But after that, this truly matters. What we must commit to is meaningful action. You, Doctor.
Thanks very much, Mr. Mayor. I'm just going to check with Dan to see if I'm coming through all right, because I have had some connectivity issues.
We can see you and we can hear you, Dr. Mackie. The connection is a little jumpy, but your audio is good.
Okay, it's a wired connection today, so hopefully it holds up. Thank you very much for your important comments, Mr. Mayor. We continue to see relatively high cases at the provincial level, still down from the peak, but higher than we are wanting to see. Locally, our numbers continue to be relatively low, 5 and 2 the last couple of days. We have unfortunately seen one death each of those days. Appreciate the comments, Mr. Mayor, about the ongoing issues with racism here and around the world. We have had many people ask us about the protest that is coming on Saturday and what they can do to be involved in the protest as safely as possible. And I want to make it clear that the best advice from a public health perspective is not to attend. But knowing that many people will, we're recommending to maintain physical distancing, 6 feet or 2 meters. And in addition to maintaining physical distancing, also to please wear a mask if you're attending that event. In addition, after the event, please monitor yourself closely for symptoms every day for 14 days. If you have any symptoms of any sort after attending a large event like this, please go to an assessment center, Carling Heights or Oak Ridge Arena, and get yourself tested. Carling Heights is 7 days a week, 11 a.m. to 7 p.m. Oak Ridge Arena is Monday to Friday, same hours, 11 to 7. That's it for me. Dan, happy to take any questions.
I got caught with the muted microphone there. My apologies. All right. Thank you both for your opening statements, Mr. Mayor, Dr. Mackie. We do have several questions in the queue, so we're going to get to those right away. Dr. Mackie, the first question is for you, and it comes from Steve Young at CTV News in London. Dr. Mackie, as part of the testing process, is the Middlesex-London Health Unit collecting information on race, poverty, and neighborhoods to better understand the impacts of COVID-19 on certain groups? If so, how is that data being collected? The second part of the question, we've seen in other jurisdictions that people living in poverty and certain racial minorities have higher instances of COVID-19 and are more adversely impacted by COVID-19. Do you expect to see that in our region, and how do you account for those impacts?
Yes, we do expect to see higher rates of illness in marginalized populations, including people who are Black Canadians living in London and Middlesex. What we are doing right now is we are collecting the race of each individual who's testing positive. We've been asking those questions for a bit over close to 2 months now, not quite, and compiling those as part of our database. The data is not complete. Many people decline to provide an answer to that question, which is of course acceptable. What has been done at the provincial level by Public Health Ontario is looking at neighborhoods where there are a higher proportion of people of racial minorities and looking at the rate of coronavirus in those neighborhoods. We can certainly do that. We have postal code information for all of our cases. We'll be bringing a report to our Board of Health at the June meeting of the board, and that's coming up very soon. It's the third Thursday of each month, and those reports become public on the Tuesday before the Thursday.
All right, thank you very much, Dr. Mackie. Dr. Mackie, there is a follow-up question from Steve Young that he'd like to ask. Dr. Mackie, can you talk to us about your decision to attend the rally on Saturday, where it's expected hundreds of people are likely to attend, prompting concerns over social distancing?
Yeah, I think one thing that public health authorities around the world are using the current opportunity to acknowledge is that racism is a public health issue. There are substantial health impacts of the inequities in our society, including those that are along racial lines. We know that our whole system has inherent bias, and in some cases, very formal biases when we talk about how the Canadian system treats Indigenous Canadians differently, and that there are huge impacts to those differential those issues that are borne more heavily by marginalized populations. And so you saw recently a list of hundreds of public health personnel in the U.S. who've signed an open letter confirming that racism is a public health issue and indicating their support for the protests. And I think attendance as safely as possible is the minimum that somebody in a role like mine that has a clear public health mandate to address issues like this can do.
Thank you, Dr. Mack. Little trigger happy on the mute button there today. All right, we have a question now. This one is actually for both Mayor Holder and Dr. Mackie. So Mayor Holder, why don't we go with you first on this one? It comes from Heather Rivers at the London Free Press. Is a regional reopening an appropriate way to balance the economic needs with our virus containment efforts? Mr. Mayor Holder, you first, then Dr. Mackie.
Yes, I haven't been elevated to the status of doctor, nor have I taken the training with a degree in philosophy. All one can do is one can do, and I'm proud to have that. Look, a couple of things. I've got some deep concerns about opening up regionally, and there's a number of reasons why. With 1 or 2 hours from our city are some of the hardest hit communities anywhere in Canada. For example, Windsor, Essex, Haldimand, Norfolk, Hamilton, GTA. And that's extremely concerning to me. I'm particularly concerned about opening up parts of our city that could be considered tourist draws for harder hit communities as close as they are. And to be clear, the other part is the Premier has not yet outlined what options municipalities might have and what those areas could look like should some form of regional reopening be considered. We'll certainly look at that, and I will tell you the paramount issue always will be the physical health and safety of Londoners. What balances that, of course, is the issues around the economic recovery, and we're sensitive and mindful of that as well. That's why we had our task forces associated with the economic impact and recovery, as well as our social impact and recovery. These are big issues, and one thing is really clear. We have asked Londoners and businesses to make sacrifices over the last almost 3 months. And the challenge that I see is that if as a result of opening up regionally prematurely has negative impacts, especially when I've heard through Dr. Mackie and others that pandemics typically have second waves, that can you imagine putting Londoners and businesses through this all over again? I find that unconscionable. So what I would rather do is deal with this very carefully. I think the Premier has been very mindful as he has provided a staged reopening and of the economy, and I think that has tremendous significance. And look, what happens if our case count surges as a result of regional reopenings? Our economy suffers and the human cost is going to be brutal. So we've asked Londoners to be thoughtful. We've asked Londoners to work with us. They've been great. And we're asking Londoners and businesses to hang on a little longer. I'm anticipating, by the way, again, depending on how numbers go, that the phase 2, as I've talked to recent ministers provincially, is likely in the next 2 to 4 weeks. But I think, again, numbers don't lie, and that's the thing that we'll be watching for as well.
All right, Dr. Mackie, is a regional reopening an appropriate way to balance economic needs with our virus containment efforts?
You know, I think the mayor's comments about the risks of reopening are strong. The one thing that I would add is how powerful it has been that we are all in this together. There are a few really powerful aspects of that. First of all, we can deliver one message across the province. We know that many, if not most, media outlets cross over jurisdictional boundaries, and so a unified message can be really powerful in terms of helping the public to understand what's going on and what they should do to keep themselves and others safe. And the other thing is that as people look around them and they see their friends and neighbors making good decisions to protect themselves and others. It's real strong social pressure and creates a culture where we're looking out for each other. And that's exactly what we need to get through this.
All right, thank you both. There's a follow-up question here from Heather Rivers again at the London Free Press, and this again is for both of you. Are you concerned about higher per capita case counts or outbreaks in nearby communities, such as Simcoe and Sarnia, affecting London and Middlesex? If parts of southwestern Ontario were to reopen before others. Mayor Holder, do you want to go first?
Sure. Clearly, there are no enter at your own risk signs in any community across Ontario or the country. And from our standpoint, nor are there barriers to entry. I think to the extent that we allowed, again, our numbers are good, but should we allow regional reopening, when should it be done at a regional level? And you know what we've done is we put up a flashing sign and saying, please join us. I have no doubt that any business that people run in the City of London are already practicing the types of things that the Medical Officer of Health has encouraged. So when you go into a business, there's limits based on square footage as to how many individuals can enter, how they can enter, how they self-distance, and do all of that. And I am confident that owners of businesses in our community would, in fact, honor those practices that have been put in place to the extent that they're now open and able to do business. Here's the challenge, though. When you say open for business and someone else isn't, there would be a natural tendency for others to say, you know what, we're weary, and I get that. We're tired of this self-isolation. I get it. But for London to become that draw, and even internally within London, for certain businesses to become that draw, I think become a challenge. And I come back to the point. If the case counts surge as a result of this, then we've not only taken a step back, we have gone way, way back. And that means we would have to put Londoners and our businesses through this all over again. And for all the hard work that they have done, I don't think that's fair to them.
Dr. Mackie, your thoughts?
No, I would agree. There are many jurisdictions around us that have higher case counts than London and Middlesex. And it just would be so much more difficult to try and increase restrictions again once they're opened. So I think the prudent thing to do is not to pursue any opening until we're very clear that it's the right thing to do.
All right, thank you both. The next question comes to us from Sawyer Bogdan at Global News Radio, AM 980 CFPL. And she is bringing this question forward on behalf of a listener. Dr. Mackie, has London or Middlesex County seen any cases of multi-system inflammatory syndrome in children? We were hearing a lot about it for a while, but not so much as of late. Is it something parents should be concerned about with COVID?
Yeah, so multi-system inflammation is related to when the infection, rather than just impacting through the lungs and the breathing, actually the inflammation from the infection can spread through the whole body. What we're learning about the coronavirus, COVID-19, is that the virus creates a lot of inflammation. It's not just about the immune system. It also triggers an immune reaction that is an overreaction to what is happening. That's part of what fills the lungs with fluids, and it can spread through the body through this multi-system impact. An example would be a child that comes in to the hospital with a black toe because they've actually had damage to the blood vessels in that toe, so that the toe is essentially died off. And very scary for families that have been impacted. Fortunately, we have not heard about this disease impact having any victims here in London or Middlesex, but it's also not something that is a reportable disease the way the diagnosis of COVID itself is. So it may be that there have been diagnoses that just haven't been reported to public health. I don't think so. It's the sort of thing that clinicians usually would tell us, and we haven't heard anything about that impacting locally, but we don't know for sure.
All right, Dr. Mackie, a couple of follow-up questions from Sawyer Bogdan again, and they relate to the protests this weekend at Victoria Park. The first question is this, Dr. Mackie, if you plan on going to the protest Saturday, will you be following the recommendation of self-isolating for 14 days? Will that affect your ability to do your job?
Yeah, so the recommendation is to self-monitor for 14 days. I know it's been reported as self-isolation, and it's something that I will attempt to do as much as possible in the 14 days after attending that event. My job has been done remotely. I'm, at my home right now, as I have been for every one of these calls. So my job won't be affected by any self-isolation.
Great. And Dr. Mackie, a follow-up here. What do you say to those who want to protest or sympathize with protesters but have coronavirus concerns? You expressed on Twitter, and again, we just talked about your intention to attend on Saturday.
Yeah, there are many ways to be involved and show support. Obviously, attending a protest is only one. I've been learning and reading about this. I certainly wouldn't call myself an expert, but some of the things that have been recommended by people of color and others who have done more personal work in this area would include reading about the history of people in color in Canada and North America, reading works of fiction and nonfiction that are written by people of color, talking with other people in your family and in your social circles about the issues that you're identifying, what you're learning about the history, what you're learning about how our society could be better off, both at the level of the culture that we all contribute to and in terms of how our organizations and institutions treat people of color. Those would be some examples. If you're on social media, follow people of color who are sharing great ideas, and always try to be aware of the issues. All of us have latent biases of various sorts. Working to uncover those biases is an important part of what each of us need to do as individuals. Speaking out if and when you hear something that has one of those latent biases expressed. There are different opportunities in terms of training. Everyone in Middlesex-London Health Unit has had the opportunity to train on Indigenous cultural safety, which is obviously related, but only one aspect of the issue. Some management have all been asked to take second level training, which is called Bystander to Ally, and gives a number of techniques of how to intervene to support people who might be victims of racism or latent bias in the workplace or elsewhere. So those are some examples, but there are many more.
That's some great suggestions in there, Dr. Mackie, and some ideas that folks can explore a little bit further. And I want to come back to the comments off the top that Mayor Holder made about the remarks before last night's meeting that Councillor Salim made. And again, I believe, Mayor Holder, you said those are available pretty widely online. All you have to do is watch the beginning of the council meeting from last night, as I understand it.
That's correct.
Great. Well, gentlemen, that brings us to the end of our questions for today. Once again, thank you for your time. Thank you for your insights and for sharing your knowledge about the coronavirus as it continues, and also some of these related stories that, while they aren't specific to COVID-19, certainly are related given the times that we find ourselves living in right now. Thank you for joining us today. Have a great rest of your Wednesday, and we'll see you tomorrow afternoon at 2 o'clock.